So good evening, everybody that's logging on. My name's Rosie. For those of you who know me, seen me before, Rosie Milsom. I'm the charity manager at Caldwell Lyme Co. If you're new to us, we're a charity that raises money to fund research into Lyme disease to help improve the testing and treatment that's available on the NHS. And we also campaign to raise awareness of Lyme disease, as well as offer information and advice to patients as well. So some of you might have joined us for our patient panel event that we did back in February, of which Emma was a guest, so she returns for a second time. As some of you, some of you are kind of regulars to our recent online events. You'll know that we put on these events for the Lyme community to give them some information, support, inspiration, access to stuff online that will help support them in their journey. And the last event was so well received that we wanted to do another one for you. So just a bit of disclaimer for tonight for the event. So what we'll be discussing, it's not an endorsement of any particular practitioner, organisation or route of treatment. It's for information and interest purposes only, and any decisions that you make that might affect your health should be made under the advice of a medical or relevantly qualified professional. So that's the boring bit out of the way. We've got a couple of questions already sent in to us, so I'm going to post them to the panel. But if, as we go along, you guys have any questions that you'd like to ask, if you pop them in the chat function, I will keep an eye on that and I will feed those through to the panel as we go along. But that's enough from me. So I'm going to introduce you to members of the panel. I'm just going to go from my top left. So we've got here today Matt Phipps, Stella Solsdorf, Emma Franklin and Bruce Douglas. And Bruce is over in, is it Belgium, Bruce, or Germany? I know I said Germany the other day and it was wrong. So his camera might jot out, but his sound is pretty good. Lovely. So if we start with Matt, because he's up on my top left, I think we might have a little bit of a sound issue with Bruce, but hopefully he can get the connection sorted. I'm just going to pop him on.
Brussels in Belgium.
Yeah, right. You got that. But Matt, if you want to start, just give yourself a bit of an intro to the guys watching, just about your kind of, I know it's hard to put it into a minute or two, but just your kind of journey on Lyme so far.
Of course, yeah. So, hi everyone, good evening. My name's Matt. I've been diagnosed with Lyme disease about 1.5 years or so ago. I started getting symptoms maybe about 2 years ago, to the point where my legs were really weak and I was suffering from fatigue, to the point where I went to the gym at lunchtime. I had just to sit down in the middle of the floor, and it was at that point I realised that I needed to do something. So I then jumped on the fun train of seeing different doctors, neurologists, probably 4 or 5 different other specialists, endocrinologists, all sorts, different tests on me, and they basically all told me I was fine, nothing wrong. So then I really looked into finding an integrated medicine doctor. And at this time I was in the US, in Maryland, which is a really good place to have Lyme disease because it's absolutely full of people suffering from Lyme disease, one of the busiest states out there. So lots of Lyme literate doctors in America. And I got a full panel of bloods done. And although I only had one tiny band of Lyme active, they could basically read that I was probably had it from the other results that were there supporting it, which no other non-Lyme literate doctor could have. So we went into a few months of building up my immune system, building me up with different things, and then hit me with a couple of courses of antibiotics. And I saw a good improvement, probably about halfway, I think, something like that. And then I moved back to the UK, basically. So they started treating me on that program. And then unfortunately I had to leave and come back to the UK, and that was last July. And I haven't jumped in with a UK Lyme doctor yet, because I'm down here in Kent, but I've kind of read different things about different doctors, and I'm not sure about jumping back in or not yet and making that investment. So I've just been kind of, using herbs since then, and managing things have been a bit better for me, and I'm doing all right, but probably not out of the woods yet. That's it.
Thanks, Matt.
All right.
So Stella, would you like to introduce yourself and again just give a brief intro to your Lyme story?
Sure. Hi, I'm Stella. I'm in the UK. So I think I got Lyme in Bulgaria. So I'm from Bulgaria. And I didn't know this at the time, but through this Lyme journey that I've been going on, Bulgaria is actually a really big Lyme hotspot. And I've heard all these stories about how you can only get Lyme in certain parts of America and Lyme doesn't exist in Europe and all these things. But I tested positive, highly positive for the Avzelli, which is the European strain. So I'm almost certain that's where I got it. However, my symptoms didn't become chronic until about 10 years ago. First started with a hit and run car accident that I was in. I still have memory loss from that event. All I know is I got hit and then I woke up in the hospital. I still can't fit the bits in between. And then shortly after that, I was working full time at a public library. I loved my job, but I started becoming horrible at it because I couldn't concentrate. I started not being able to wake up. I had to constantly sleep. So I had to leave my job. Went to my GP. He was like, oh, you've got chronic fatigue. That's all you've got. Didn't get any support. I started getting horrific back pain. I started to get Bell's palsy, which is when one side of your face twitches and gets stuck. I mean, even now my lips are still to the side because of how much I get it. Speech arrest, I started to get seizures. And then this back pain started spreading to my legs. And then I started limping on one side, not being able to walk. And then eventually by 2018, I was completely bedbound. I had to rely on my husband to do everything for me. He had to feed and wash me, which was happening like once a week, every 2 weeks. And eventually I got to see a rheumatologist on the NHS who told me, oh, you've just got fibromyalgia. And I was like, I'm like bedbound. I can't do anything. I'm paralyzed. And not being convinced by that, I saw a private rheumatologist who ran the Lyme panel. He did IgG and IgM, came back positive, put me on doxycycline for 3 weeks. After the 3 weeks, I wasn't better. And he said, I need psychological help because that would have fixed all my problems. So I was obviously distraught. And then I sought help in America from a naturopath called Dr. Darren Ingalls, who told me about Breakspear in Hertfordshire. And that's where I am now, basically.
Thank you, Stella. It's quite a story, isn't it? And it's funny, just noticing between you and Emma, because Emma, you had a car accident as well, didn't you? I think when you were 13, was it? You're just on mute at the moment, but you're kind of next on the line, so I don't know if you want to tag in.
Me and Stella met through Instagram, and when I recognised her symptoms, I said to her, it's like parallel, our stories. It's crazy.
Emma, I don't know if you want to pick up your story there, just as you are next in my...
So I'm Emma. I have Lyme as well. I was just a perfectly healthy child, and then I went on holiday to Florida when I was about 11, but I also live near Cannock Chase, which is a hotspot for ticks. It's a huge forestry area in Staffordshire. Came back from that holiday or that summer, was at school, the teachers starting to notice I'd gone from top of the class doing my GCSEs a year early to couldn't read properly, couldn't write properly, a lot of behavioural problems, still a child. And then I was kind of okay-ish. And then when I was 15, I had swine flu when it was the pandemic, and I had EBV, glandular fever. And after that, I developed chronic fatigue, ME, all the flu-like symptoms. And then when I was 17, I had a car accident and a ski accident with a severe head injury and trauma to the neck. And then I developed neurological problems and was diagnosed with fibromyalgia, and went on to be diagnosed again on the NHS with POTS, chemical sensitivities, neuropathy. Just deteriorated basically until I was 21, and then I was totally bedridden for a year, very similar to Stella. I just was in a pitch black room, couldn't tolerate any light, any noise, couldn't even talk, had to be spoon fed pureed food by my mom and carried to the bath, washed once every 2 weeks, was about to be put on a tube to be fed. And then I discovered Lyme disease on YouTube, and I was like, there's this girl being carried around who is paralyzed. And I was like, wait, that looks like me. What's this Lyme disease? Never even heard of it. Googled private Lyme tests because my GP refused to test me, saying, you know, you can't get Lyme here, all that kind of stuff. Even though there was a vet down the road with massive beware your dogs of Lyme and ticks, literally 2 miles from the GP surgery. And then I've been at Breakspear Medical for treatment since 2016, I did 2 years. And then I moved to a doctor in central London, focusing more on detoxification. So Breakspear helped me get so far with the infections, and then that doctor helped me get to the next level. And then I've been working with some practitioners who are trained by Dr. Cleanheart, who is one of the best Lyme doctors in America, for the last 2 years. And that's kind of got me to the next level. Doing a combination of a lot of things like herbs, detoxing ozone, all kinds of physics, a lot of different things, addressing mold and heavy metals, parasites, dental problems, like the whole package really. And I'm a lot better than I was. I'm still not well, like I still can't live a normal life, and I still am unwell all the time, but I feel like I will get to that point eventually.
Absolutely, great note to end it on. And Bruce, hopefully you can hear me. I know you were saying you're going to keep your camera off to kind of help with the bandwidth issues. So if you want to introduce yourself and give everyone a kind of brief overview of your Lyme journey so far.
Yeah, thanks, Rosie. Can you hear me now?
Yes. Great.
Okay, apologies for that. Possibly my children are streaming YouTube and taking the bandwidth, who knows. But listen, Rosie, first of all, thanks so much to you and Coldwell Charity for putting this on, and all the other activities. I'm just so grateful for all the work you do. It's just so important. And
thank you.
Yeah, no, it means so much to everybody who's either got Lyme or knows people with it. And you know, my story is very similar to the others, where, you know, it's just unacceptable, the lack of awareness and understanding in mainstream medical community. And I think the work you do is just critical to moving the whole Lyme issue forward. I mean, my story in brief was in about 2017. I just noticed that extreme fatigue. I mean, I used to do a lot of sport competitions, and my results were getting worse and worse. And then I started getting headaches, and I mean, fortunately, mine was only neurological Lyme, so I didn't have any physical symptoms as such, mainly psychological. So it was headaches, difficulty sleeping, a lot of fatigue, but also more worryingly was things like anxiety, memory loss. And what I understand now from doing a lot of research, linked to, you know, inflammation, brain inflammation. You know, the memory loss got so bad, I forgot the PIN codes of my credit cards. I forgot how to speak French, and I live in a French-speaking country. And so, you know, it's a scary and lonely place to be, you know, when you don't understand what it is. And so diagnosis is critical. And I think anybody who you know or associate with who have similar symptoms to what we're describing, then get them to do multiple diagnoses. I mean, I went through several doctors, and only finally, after, you know, the third or fourth, managed to get a blood test that was positive to Lyme. I even went to the tropical disease hospital, and they said that I was just getting old, which was not only insulting, but I thought it was quite dangerous to tell me that. And so what's pulled me through is, you know, the support and understanding of my friends and family, and the cures. I mean, you know, interestingly, I would never have thought this before I started this journey, but the things that worked best were obviously a complete lifestyle change. I mean, I was on you know, full speed ahead in terms of traveling, working, and sport and so on, but also things like, you know, just detoxing in every possible way, but also the bioresonance helped me a lot. A lady called Paulette Agnew was just wonderful in terms of her support of me, and bioresonance helped a lot. But also herbs, and for me, that one of the most powerful things was relaxation. So meditation and breath work, really focusing on that, and positivity, which I never would have thought would be so powerful, but in fact it's extremely powerful for me. I would say I was almost fully recovered now, and there's a lot of silver linings. Maybe I'll come on to those later, maybe at the end, you know, about the positive things that have come out of it. the learnings I've had. But just to repeat, I really appreciate the work you're doing, Rosie. Thanks.
Oh, thanks, Bruce. Thanks for sharing that. And yeah, I absolutely would love to end on some, you know, positive, like you say, silver linings, things to learn. You know, I think that'd be a great message to end on. So we'll absolutely come back towards to that towards the end. And I think one thing that I would say, knowing you all and you know, as I do, and how you've approached treatment, is that there tends to be like a mixture of approach. So there might be, so I know most of you have had antibiotics at least at some point, but also combined with a kind of holistic approach, or, you know, detox, like you say, relaxation, Bruce. But yeah, I know that you have all got various approaches to treatment, but there are definitely some crossovers when it comes to Lyme. So I'm going to start on some of the questions that we've got, because we already had a few and I can see some more coming through. So I will go straight to those. So the first question we had was, so we'll start with this one because this applies to a couple of you and I can see a few more people mentioning it in the chat. But bioresonance, we had a question here. So anyone that's had success with bioresonance, were you doing it alongside other treatments, say antibiotics and herbs or herbal protocol, or were you doing it alone? And someone else had asked you in the chat to speak more about bioresonance. Bruce, I know obviously you've used it, and Emma, you have as well, haven't you? So Emma, do you want to give your experience or answer first?
Yeah, so I started it, I think it was a couple of years ago. I found it really beneficial. Specifically, my main problem is like chronic fatigue. So for that, but I wish could have kept up with it, but it was very expensive compared to a lot of other treatments, which I could have also seen benefit from. So I decided to stop it. I do think mainly it is a great support for the immune system. So it can help your symptoms be less severe and become more stable. But I personally don't feel that alone. I guess, again, it depends how unwell you've been, how complex the case, but I don't think that alone, I don't know anyone who's recovered from that alone. I think in combination, like a lot of people with Lyme, it's a combination that gets them fully better. But I do think it's worth a try for anyone to try, really.
Fab, thanks, Emma. And Bruce, how about you?
Yeah, I would echo what Emma said. It's a combination of things that helped me get through this. I didn't take antibiotics. I did a lot of research and spoke to a lot of doctors after my diagnosis, and it was just clear that I was so far down the line that it was just pointless. Antibiotics wouldn't touch it. You know, the fact that the Borrelia just hides in, it was in my central nervous system and my brain infection by then, so no point. But bioresonance definitely helped, and especially, as Emma says, with the immune system boosting. I mean, I wouldn't say I was a cynical person, but, you know, I definitely question everything, and the, you know, to be told that a remote bioresonance treatment could help was bizarre in the extreme. But I would say I wasn't willing to try anything, but I was pretty open to everything. And it had amazing results, and I had, you know, the initial treatment and this was Paulette working in Holland and I was in Belgium, whatever, 500-kilometer distance, and it had an amazing reaction to it, you know, and so I could highly recommend that to people. The expense is an issue, and, you know, because it's a long-term treatment that you need, and so that should be taken into account, not just the cost, but also the energy and time involved. So, you know, you got to weigh it up, and I think Emma's right. You got to look at all the options and weigh those up, and a combination helps. For me, it was to really get over it was the herbs, Artemisia specifically, and the bioresonance together that got rid of most of it. And then from then on, it was, you know, positivity and the relaxation meditation that really helped me, you know, on that journey.
Thanks, Bruce. And talking about herbs as well, I think, Matt, you have been using kind of herbs and stuff as part of your recovery. Do you want to tell us a bit about that?
Yeah, so Berber, Pinella. I mean, I think a lot of my should have said really, I think my bite was probably 10 years ago. So my body was suppressing the symptoms for nearly a decade before it emerged. So much like Bruce, I don't think the antibiotics had a massive effect for something that's been there for so long. But yeah, the US approach was the doxycycline, boosting the immune system, but then also lots of different herbs like berber, pimella, and then there were some, I'm trying to think of the names of them all now. I have to write them down in the chat actually. I think I'm trying to remember them off the top of my head. There was about 5 different little lotions and potions, and I would mix them all together. And that had quite good effects, I could tell, because I was herxing with them as well sometimes from that. So I think it's a good approach to do that. You know, these little things cost 40 to 50 pounds, but if you can, you know, combine 2 or 3 of them, it targets the biofilms, helps your lymphatic system move. It told me it makes it more slippery. That's the berber, which helps with the detoxification. And my Lyme doctor in Maryland said it was about 80% as effective as antibiotics to be taking the herbs. And it's just, you know, in a shot of water, and you can do it in 2 gulps. It's not too unpleasant either. So I would certainly recommend, there's no harm in going that kind of plant extract approach as well, alongside other treatments.
Fab, thanks, Matt. And I think, like as all of you have said, and as I've heard many people say before, you see the story seems to be that the majority of people get better with a kind of combination approach. Is that what you found as well, Stella? Or
Yeah, I mean, I've tried so many things at this point, but I found that with Lyme, you often get things like viruses, mold, toxicity build up. And because your immune system is so run down, you're so susceptible to getting infections and all these things. And what I found, or at least from my experience, is that you have to treat those, otherwise the Lyme treatment isn't as effective. So I've had a lot of back and forth and having to stop and restart because I'll catch a virus and then I need to treat that, or I need to sort my mold or parasites, and it's a whole array of things. And it almost feels like it doesn't stop, but you do get better, you do. And like, I can say that because 2 years ago, I was completely paralyzed in bed, and now I'm getting up and I do yoga and mindfulness and all these things. And I have some bad days, but there is always hope to get better. And
yeah, absolutely. And if anyone isn't following Stella already on Insta, you should, because her account is so beautiful to look at, and she is so great at what she does. Loads of kind of yoga moves and challenges. It's really, really great. Moving to some other questions. So Matt, I know you are currently, or when we last spoke, you were saying you were getting some good results with a carnivore diet, which is quite different to what a lot of Lyme patients go for, because, you know, meat's thought to cause inflammation and you know, stuff. So I had a few questions for you on that, because we did mention that in your profile, so a couple of people have picked up on it. Yeah. So they were saying, have you any experience with dry fasting in addition to carnivore diet, was one of the questions. And then the other ones were, has your gut found improvements on carnivore, and do you go out of your way to get low histamine beef for your carnivore diet, or do you not feel the need?
Okay, yeah, so the carnivore diet, it's an interesting one for me. I'm not, you know, against veganism or anything like that either. I think that's a good way of approaching things. The way I've kind of approached diet is, I think the combination of fats and carbohydrates together is what really causes the damage, especially for people like us who are suffering from an immune condition. So if you can remove the carbohydrates from there, or remove the fats, then you're kind of limiting that, and the body's not storing everything, the inflammation is decreasing. So I've tried keto before and it worked quite well, but this time I read a book on the carnivore diet, and it's quite appealing to me. I think my blood type lends itself to that kind of diet as well. I've tried vegetable and fruit-based diets before and really struggled on them, but I find this a lot easier. It's very simple. It doesn't get boring. The taste is amazing for me, and it works really well. So cut out all of the carbs. I lost 8 kilos in about 6 weeks. My blood pressure dropped from 140 over 100 to 120 over 80, again in 4 weeks. So I lost lots of weight and I became sharper in my head, and obviously lost a little bit of weight as well, and just felt generally better about myself, less fatigue, less brain fog. You know, it wasn't a be all and end all of anything, but certainly by giving your body the right nutrition, you can really kind of progress things and give your body more strength in the immune system. So I think the inflammation came down, and that helped me a great deal. In terms of supplements, I think just some magnesium really alongside it, and maybe a multivitamin. But I haven't felt any kind of, haven't started suffering from scurvy or anything like that. I've read a couple of books.
Well, I hope you're still eating your veg. It surely doesn't mean you're not allowed that.
No. There is the doctor who wrote the book I was following. He's been on it for a couple of decades, and he's fine. So
always reassuring.
Most people are, but if I do start to notice anything, I'll introduce green veg or something like that, so I can get some other nutrients in. But generally speaking, I feel great on it. Your appetite decreases, your hunger goes down, and everything plateaus when you're in ketosis, which is really nice. It makes things easy, and I just feel better for it. So yeah, I'll keep pushing.
And has it improved anything on your gut or?
Yes, yeah. So before I had kind of sensitivity in my gut. So if someone rested an arm on my gut or something like that, it was quite sensitive, but actually that's kind of gone away from that as well. So I think it makes a big difference. You remove all of the sugars and the other processed stuff, then those bacteria that thrive on that tend to die off in the gut, and hopefully that has some effect on the Borrelia as well, in terms of fueling them with those simple carbs. But yeah, definitely feel better in the gut as well, which I think plays a big role in this.
Cool, thank you for sharing. Next question I saw in the chat was about IV ozone therapy. Do any of you, Emma, I thought you might have had some experience in that. So yeah, I mean, they were actually saying, Emma, did you have it? Do you want to share your experiences?
So ozone, I had so many infusions that my veins weren't usable anymore, so I couldn't do it directly into the vein. So I did rectal ozone. I don't think you need an explanation of what that is, but so I did that, and my personal experience was that it partly helped me because ozone is really good for Lyme, bacteria, viruses, mold. It's good for multiple different things, but part of it made me more unwell because I didn't realize at the time I had a very heavy parasite load in my gut with gastroparesis, so my gut was paralyzed. I wasn't having bowel movement, so the combination of doing the ozone straight into the gut, killing all these parasites and not getting rid of them, it made me more unwell. But I think if you avoid doing rectal ozone and you can do it in an IV form, it can be really beneficial. But again, similar to bioresonance, it's kind of like a supportive treatment. It's usually would be combined with other things like detoxification or herbs and antibiotics. I don't think that alone can help someone fully recover.
Okay, thank you for sharing. Did anybody else have any experience or knowledge of ozone, or is it just Emma for Emma either? Oh, yeah, go on.
Say as well, I'm actually about to start it again soon because you can buy an ozone machine. Obviously, I wouldn't recommend people to just go and do this, consult with your doctor, but a lot of doctors and practitioners now are recommending people to buy the machines. You get them from America and you can do it at home. You can do rectal, in your ears, up your nose, in your mouth, instead of IV form, but it can be beneficial for a multitude of things. So if you have a lot of different problems, then it's probably something good to look into.
Okay, fab, thank you. There's someone in the chat that says, well, someone says, I agree, Emma. Might have been, just that comment then, I think. And then someone said they had ozone injections in their neck and it eradicated vertigo, which is interesting. So next question was about the bee venom protocol, which I've seen a bit about on Instagram, but I've got to say I don't know too much about it. Is that anything that you guys have looked into or had experience of? Or Emma's like, yeah, that's me again.
Do you want me to say? Yeah. So I've looked into it a lot. I've never done it. I think when it's specifically the Borrelia bacteria itself that are making people feel unwell, people seem to have a lot of success with it. But like Stella said, when people have viruses, mold, all these other problems, it doesn't necessarily help that. And also you have to be quite strong to be able to do it. So I think if you have like severe chronic fatigue and you're extremely weak, it's such an aggressive treatment, it's not good to do. But if you're quite physically fit and well, but maybe you have neurological problems specifically from Lyme, people can see a lot of success with it. And also if you have histamine issues, the bee venom is very high in histamine, so you have to either be on like a low histamine diet or not have those issues anymore before you start it. That's just from what I've researched and spoke to.
Yeah, I guess that would be understandable given that some people have quite severe allergic reactions to it. I guess that would make sense. We've got one about parent technique, but we'll come back to that in a moment because I know that Emma is one of that as well, but I won't give her a break while she has her coffee. There's someone here that mentioned they didn't see their bullseye rash and their homeopath kinesiologist told them that they were bitten in 2017, a disequilibrium in one ear and Lyme neuropathy, really came out with a lot of trauma and stress. My main problems are with Lyme are that the Lyme has caused a migraine variant disorder, and I wondered if anyone had had any experience of this. Bruce, you mentioned that you experienced quite a lot of headaches. I don't know if that's kind of similar to migraine variant disorder. I'm not familiar with it, but I don't know if you want to share your experience there.
Yeah, I don't think it is. I hope my video is working now, Rosie. I've switched devices. Yeah, no, mine wasn't the migraine. I mean, mine was just a permanent headache. I mean, it was like having a swollen head. That's what it felt like, and almost like it's crept up on me, over a year or so, and to the point where I just couldn't function anymore because of it. But I don't think it was a migraine as such. It just felt like my head was swollen, and all the things I mentioned helped with that and with the inflammation.
So maybe it's something that they could look at from that point of view, like you say, doing these things to try and reduce the amount of inflammation. How about any of the rest of you? Headaches or migraines been much of an issue?
Not suffocating, but it's definitely an inflammation of the nervous system thing, Rosie, I think. So if you target inflammation in general with those different techniques, then you're going to hit the migraines quite well. So I think that would be the approach I would take.
So Stella, what were you going to say?
Oh, I was just going to say I have quite severe neurological issues from Lyme. So I've got neurological Lyme, and although I wouldn't say I've got like a migraine issue, I found things like magnesium, vitamin D, and those kinds of supplements, zinc especially, can really help. I just think it's like to do with inflammation of the brain, from what I understand. So yeah, that's what I was going to add on.
Yeah, thanks, Stella. Someone's asked a question here, which I will just take on. I've just moved it. They were saying that they'd had a private Western blot done, and they were negative on the IgG but positive on the IgM. They took doxycycline for 3 weeks, and she recently asked her GP 6 months after the antibiotics for another test, and he said there is no need for that. How can I know that I'm negative? Can I ever be negative, and does anyone know the answer? So I'll kind of take that one on. So Anna, the current tests for Lyme disease are, whether that's private NHS or not, they're generally antibody based. So they can only really tell you if you've ever had Lyme disease, or certainly the test that you'd be able to ask by your GP. So if you've had antibodies, basically that's all the test does. It looks for your antibody response, and if there is an antibody response, or it looks for it and finds it properly, then your test will come back positive, and that's even if you've been treated and cured. So unfortunately, there is no test for cure that exists. There's no test for cure for Lyme disease. It all has to go on your clinical symptoms. Once you've been tested as positive, your doctor should be after treatment be looking at your clinical symptoms and deciding whether or not you need further treatment, and that's as per the NICE guideline. So 3 weeks of doxycycline is like the minimum amount of treatment that you get on the NHS. If you still have symptoms after that, doctor should be prescribing usually a further 3-week course of amoxicillin. But Anna, if you want to get in touch with the charity separately, I can let you know what else is on the NICE guideline and what you might like to take back to your doctor if you want to continue discussions with them on that. So moving on to the next one, we've had a question about whether anyone uses Rife machines or infrared saunas. Emma?
Infrared saunas has been a really big part of my recovery. Detoxification in particular is probably what's helped me recover the most, and treating viruses. But yeah, you can get them for at home. Firezone is a really good company. They're not too expensive either. But I do think with Lyme, it's not always about treating the bacteria itself. If you can detox your body enough to get as much toxins out as possible, a lot of the time your immune system can then overcome the Lyme. So like for me personally, detoxing has been more effective than treating the Lyme itself. But a lot of people, basically everyone I know with Lyme has an infrared sauna. It's like a tool in the toolkit, but definitely I recommend Rife. I don't have any personal experience with it.
Anybody else on the panel got Rife or infrared experience?
+1 for the sauna approach for me. The doctor I saw in Maryland said that my detoxing was the biggest problem for me, that I wasn't detoxing. My Lyme wasn't as severe as perhaps some of the guys here are suffering, but my body wasn't detoxifying properly. So that was one approach. I've also got these awesome squeezy leg things that you put on and they squeeze air up your legs, called Normatex. They're pretty cool as well. But the best thing you can do is to bounce up and down on a mini trampoline, which for most of us isn't something we can do that easily without then spending the rest of the day in bed. But yeah, getting moving and getting that lymph moving around the system is helpful. And I think saunas play a big part in the detox as well. One other thing that while we're talking detoxification, my doctor said that the latest that they're following in America now is the Ritchie Shoemaker protocol. So he's a mold expert and does everything mold, but for him, Lyme is in the same bracket as mold. So he's all about things like binders like Cevalan, which bind with your bile and help to remove toxins from you, among other things in his treatment. So the detoxification piece is definitely a big part of this recovery, I think.
Yeah, Rosie, just following on from Matt on the sauna side. Yeah, I mean, one of the doctors I saw, it was a great doctor who is into complementary solutions. He the 3 things he said to me, and again, when at the time I was like, you know, found it bizarre, but it did help a lot. Was the first one was take showers at the end of each day, and it just helps just get rid of negative ions, negative energy at the end of the day. The second was get rid of all mobile phones, any EMF Wi-Fi, eliminate it completely from your life as much as possible. And the third was the sauna thing. So I took him up on that, and it was really, you know, I did regular sauna visits, you know, traditional sauna, not the infrared, and I understood it was something to do with the, you know, the raised temperature and the detoxing together really helped. And I must admit, it did help a lot, and also it was quite enjoyable. So, you know, again, going back to this positivity, trying to inject some level of fun
like
into
a
your life
mood boost
again.
or something. Yeah. Fab, thank you. So I know so far we've discussed that it's a combination of things that have gotten you guys where you are at the moment, or that you're finding to manage the condition. But Anne has asked, hi all, has there been one herbal treatment that you've tried that you have found to be the most beneficial or given you the biggest improvement in symptoms? So I think, you know, you're all in kind of agreement that you've tried various things, but what's like the one herbal treatment? Or Stella?
So I did the Zhang protocol, which is not, I don't think it's that well known in the UK, but I found it the most extensive and covered the most things. So it covered not just Lyme, it's highly looks into parasites as well. It can help with the immune system. and help you to fight viruses on your own, so they don't keep coming back, because I know with Lyme a lot of us keep getting things like EBV all over again and stuff. And I found the Zhang protocol to be the most helpful. I did try the Cowden and I just couldn't get on with it because I've got quite a high alcohol sensitivity. I know Buna's quite popular, but I found that Zhang is very similar to Buna, but with a little bit more extras.
Could you
my personal experience.
Could you pop the spelling? I think I know which that you're on about, but would you mind popping the spelling in the chat, just because there's a couple of people asking what it is.
Oh yeah.
Just might be helpful for them to know. Bruce, what would you say was your kind of biggest game changer?
Yeah, two things really. I mean, the doctor I first saw, and she diagnosed it. She took the bloods. I mean, she was fantastic at all supplements, and she was, great nutritionist. So I took a lot of supplements, and some of them I'm still on now. Magnesium and vitamin D and so on that Stella mentioned. But in terms of the herbs, it was really Artemisia was the one. And I bought one. It was the NPEA, it's called. But I mean, any Artemisia, you got to get, a good quality one, I imagine. But she put me onto one that did work extremely well. And the other one which helped me relax, and I still take it now, is CBD. It's medical marijuana, and that's very effective not only for sleep but relaxation. And I can strongly recommend that as not just for Lyme, but for any anxiety or insomnia or multiple. And the list is long, actually. I won't go into it, but do some research on CBD. It has, I think, quite miraculous effects.
Do you have one that you can recommend? Because it's so hard to find a good one on the market.
Yeah, someone else has just said that one. I know Emma's got some recommendations on her blog as well. But
on CBD, interestingly, I mean, I've got a conflict of interest because I'm now an investor in a CBD. We because it worked so well, we actually launched a startup, and we're the market leader in Belgium in CBD. So CBD oil. So I probably shouldn't say the name because I'm conflicted since I'm an investor in it. But I'm sure you can find it in Belgium.
That's very diplomatic of you, Bruce. Matt, what would you say was your kind of biggest game changer?
It's difficult, really.
Still undecided.
Still undecided to put a finger on everything, but I was just pushing everything, pushing the herbs, pushing the supplements to support my immune system, and pushing the antibiotics at the same time to pick up. But there was no, I haven't had like a game-changing moment at the moment, but I'd say the diet has probably had the greatest effect for me. And I think really supporting your own body and your immune system, in my point of view, is the biggest thing to do. So there's the killing of the bacteria and the targeting and everything, but actually supporting and making your body stronger is probably what gives you most relief from symptoms, I think.
Thanks, Matt. And Emma, it'd probably be hard for you because you've done so many things.
I could narrow it down though. I think treating EBV and Babesia with prescriptions, acyclovir for EBV and Babesia with artesunate, which is very similar to, it's basically a painted version of the Artemisia. That's what got me from bedridden to a bit walking, and then really moving out of mold, detoxing mold, really focusing on detox, mold, removing mercury fillings, detoxing mercury as well. Got rid of all my neurological problems and rid of encephalitis. Was when I had wisdom teeth that were infected. When I got those removed, it took away all that kind of stuff. And then, yeah, so I'd say those are the main things. Like I've done a lot of things, but I'd see those were the points in time where my family and like everyone could recognize a big shift after each thing.
Thank you. And mold has been mentioned a couple of times on tonight's talk. Jacqueline has asked if anyone could talk about having a mold issue and how they overcame it. Stella, did you mention something about mold, or was that more a general thing, or is that something that you've experienced?
I have been dealing with mold and I'm still trying to tackle it, but I found that binders really help. So I've written it down because I can't remember, but it's called cholesterol. That's what I took, and I had to take it for quite some time. And the thing I find with mold though is that it's always around us. So you might have it in your house and then you eliminate it, but then you might have it in your food. And then so even though you take binders, you're always playing catch up. So I find it something we constantly need to work on, detoxing mold, because especially in England where we've got a humid climate, I find that it's so hard to be mold free. I know you can do it. Like for example, I've just recently changed all my doors because they had mold on them, and that's helped a lot. But yeah, that's just my experience with mold. I just think it's something that we constantly have to work on, even if you don't have Lyme.
Thank you. And Bruce, was that, are you just off mute, or is that something you had experience into?
No, not mold, but I've been told to look into it. I mean, you know, post Lyme, I mean, you know, fortunately, as I said, I'm fully recovered from it, and it was short-lived, and you know, again, relative to other people, my symptoms were quite mild, but still shocking. But yeah, mold is something that people told me about now that I should be looking into, and so, you know, I'm doing some research on, so that's really useful, Stella, thanks. And you know, I'm going to pursue that avenue a bit just for general health.
Thank you.
Rosie, can I just pitch in on that as well? I mentioned earlier Dr. Richie Shoemaker, who's this American doctor who's written books on surviving mold. I mentioned his protocol is also applicable to Lyme as well. It's like a chronic inflammatory response pathways he targets. And like Stella said, you use a lot of binders and other treatments. I'll drop a link into his protocol in here as well, but that's what the US doctors were championing in at the moment as kind of the lead for all of this kind of detox and mold and Lyme as well.
Yeah, I found that were really helpful. Thanks, Matt. And in the chat, we had a comment about recommended books for detox. Emma, I don't know, I know you've got a recommended book section on your website. I don't know if you want to drop a link maybe in the chat.
Put a link in. I just wanted to say as well about the mold. I think when people are treating Lyme, if they're not seeing any progress, that's tend to be when people would do, you can do a mycotoxin urine test to see if you've got mold in your body. And quite often it is the mold that is holding people back from improving with the Lyme treatment. And then once they start detoxing the mold out of the body or adjusting it, like Stella said, in her home environment, that's when they can make that progress, because mold suppresses your immune system, so you kind of can't get on top of the Lyme if you have a major mold problem. That's what I found personally, but I'll share the link for the book in the chat.
Thanks, Emma. And we've had a couple of questions on pairing technique now, so we should probably come to that in a moment, but whilst we'll come back to that once you've got the link. Has anyone successfully helped any symptoms they were experiencing around OCD or brain fog whilst they have been under treatment? So any of you on the panel, I mean, Bruce, you mentioned that you suffered quite a lot with, you know, confusion and forgetfulness.
Yeah, brain fog, it was catastrophic for a while. I mean, you know, the fatigue was one thing, and, you know, you can almost handle that, you know, not being able to get out of bed or whatever, but the confusion and the brain fog, that's devastating. And, you know, like I say, the memory loss and confusion, it's a strange one because it creeps up on you. You don't, you know, it's not like one day you're fine, the next you're not. It's and it brings on, you know, anxiety and you know, you really do feel lost. And I think the thing that really helped me with that was the relaxation and the sleep. I mean, you know, ironically, you need to sleep the most, and the Borrelia really tries to make you not sleep. But I'm sure it's just tricking you into not sleeping and weakening your immune system, so it has a better hold on you. And I think everything possible to try and boost your immune system. I found sleep really important, and although difficult to get, it was one of the things that made me the next day at least feel like I could function.
Fair enough. And has anyone experienced, you know, OCD type symptoms as part of Emma? Oh, I think you're still on mute. Lovely.
was diagnosed with autoimmune encephalitis following the Lyme diagnosis. So it's where your brain's inflamed and your brain actually starts attacking itself or your immune system, and you can test for antibodies for it. It's called the Cunningham panel. And a lot of my problems were, like I said, as a child, but it got worse, behavioral, psychological. And I was diagnosed with bipolar and OCD, and I was put on medication for that. But since detoxing all the junk out of my brain that was causing those kind of behavioral and psychological problems, I'm like off the medication. I was on medication for years for these things. So I do think, yeah, if it's in your brain, and it can cause a lot of these problems, but I think once you treat it and you detox all the junk out of your brain, it is definitely possible to overcome all the psychological problems as well.
Thanks, Emma. And do you mind if we come, I've just shared a link in the chat to the Q&A that we held with Dr. Ray Perrin last month on using the Perrin technique for kind of lymphatic drainage to help with Lyme disease symptoms. Emma, I think you're probably the one with the majority of experience on this, because I know you were treated by Dr. Perrin himself, weren't you, originally?
It was a really big turning point. I think for the 2 years at Breakspear, it was very focused on treating infections, which got me so far, like I said. But when I started doing the Perrin technique, which is a type of lymphatic drainage, it is good for Lyme, but really when people with Lyme have chronic fatigue, ME, because it's focused on, like everyone said, detoxing the lymphatic system. If that's totally congested, people present with this ME type syndrome. And it was really when I started doing that, which was got me from out of a wheelchair into being able to walk, relying on less care. I've been doing it for like 2 years now. But I'm like a really big advocate of it. And Ray even mentioned me in his book, because I talk about it to everyone, and he said he's got a new book, so I could put the link in it. And he said something about me, you know, telling everyone about it, because I wish I'd have known. I was diagnosed for 10 years with ME before I found out I had Lyme. And the reason I tell everyone is because if you have ME or chronic fatigue, like this is definitely like something that you should try. Yeah, I don't know if anyone has specific questions, but that's just my experience.
Yeah, no, that's good. Thanks, Emma. And we have another question here about cold water therapy and Wim Hof, and I know you're an advocate for that as well, aren't you?
I was doing it a lot. I think it's similar to what someone was saying about the cold showers. It can be really beneficial for lymphatic drainage. But recently I stopped doing it because if you have quite weak adrenals, which people with chronic fatigue, ME, if you're very weak, it can be quite taxing on the body. So I think if you're more physically fit and strong, it can be really beneficial. Like someone was talking about the cold showers, but if you're quite weak, it can almost be like too much. But Wim Hof is amazing. I've actually got his book here. He's got a really good book about it, and he has a free YouTube channel, a free app, so people can kind of try it and see how they feel. Does it help them? Does it not?
Thank you. We've got a mention here about any views on coffee enemas. Anyone come across that, considered it? No. Emma, yeah.
So again, it's like if you were quite weak, it can be really taxing on the adrenals. For me, it's only ever made me get that kind of ME crash. But I know other people who absolutely swear by this. It flushes your liver of all the toxicity, and it can get rid of parasites as well. I know people, yeah, who think this is a huge part of their recovery, but for me personally, like it's not been so great. So again, it's something to try. Like everything we've all talked about, you have to kind of try and see what works for you, because it's all different.
Okay, thank you. And just one further question that someone popped through about the Perrin technique was, they wondered whether you thought the self-lymphatic massage that he mentions in his book is just as good as seeing a practitioner. I can't imagine.
No, these people have gone on to study osteopathy for 4 years and then train in Perrin for 2 or 3 years. So there was 7 years training before they even treat anyone with the Perrin. I mean, what you can do at home will maybe help in between, but it's not gonna get you better like they can.
Yeah. And that would make sense, you know. It's like trying to massage yourself anyway. It's never as good as someone else doing it. Just the last couple of questions that are here. So we had a question from someone asking whether anyone has used Napier's herbalists in Scotland. I mean, I'm reluctant to kind of give personal opinions on specific institutions, but it doesn't look like anyone has any specific experience of that anyway. So apologies, Laura. We had another question about, has anyone got any top tips for Bartonella? Anyone dealing with that co-infection that they know of on the...
I mean, I had Bartonella, but I found the herbal protocol I was on had a lot in it that helped with Bartonella. And I found Bartonella hasn't been an issue for me for about a year now. So I think most herbal protocols have that as part of it, from my experience anyway.
Fab, thanks, Stella. So I think that's all of the questions that had come through. And Matt's just shared a link as well for a herbal protocol that's he says is excellent, recommended by his doctor, and that people might want to look at and discuss with their own practitioners. I know I think I did see a question about the vaccine at one point. I do apologise. When we included a question about a vaccine at the beginning of the year, we got a complaint. So we try and avoid any contentious subjects around the vaccine, just so we're not seen to be, supporting discussions around vaccine hesitance and stuff like that. So apologies if we've not been able to share that. But it'd be great, as we spoke about at the beginning, to kind of end on the kind of silver linings, the things that you have learned, the things that you wouldn't be without this having happened to you, and just giving that hope that things can get better and you can find out a way. And I know that some of you have been lucky enough to get that private treatment, and obviously not everybody is able to to have that funding to do those things, but that there are things that most people can do to try and help manage the disease and get things better. But Bruce, you were one of the ones at the beginning that at the beginning of this chat that kind of spoke about the silver linings and wanting to share the positives that you found. So I don't know if you would like to kick that off.
Yeah, sure, Rosie, thanks. And as I said, I think positivity is absolutely critical to this. And for me, I'm fortunate to have recovered from it. And for me, things like this webinar is a perfect example of the positive aspects that come out of it. Meeting you, Rosie, meeting the other panelists here, learning a lot, exchanging ideas. I think it's absolutely critical that we raise awareness and understanding of this disease as much as possible and as wide as possible, as fast as possible, because it is devastating and really unknown in many areas, and it's inconsistent between different doctors, and that's clear from this discussion again. And so the work you're doing, Rosie, is one of the silver linings. We need to get out there and make the message heard. I made myself a promise when I got Lyme and during it, that if I ever recovered, and when I recovered, that I would dedicate some of my time to getting the message out there. So I think that's critical. The second silver lining is that following the bioresonance success, my wife actually is retraining as a bioresonance practitioner, and she just recently launched a business in that, and she's got some clients treating chronic illness. So she's transitioning out of the corporate world and into complementary medicine, and I think fortunately I can now benefit from that as well. She treats me pretty much on a daily basis, but that's another great thing. And finally, me personally, my understanding of myself, my health, and my lifestyle is just so much healthier than it used to be, and I think I'm almost grateful for that. I could have done without those years of Lyme, but there is a positive, and for people out there who are suffering, just stay positive, stay persistent, and keep on it, because there is a way through. But yeah, thanks a lot, Rosie, again.
Oh, thank you, Bruce. That's really nice. Stella, how about you? And one thing we didn't touch on too much is about the yoga and whether or not part of the journey, was that something you did already? Is that part of the journey that you part of something you found as part of the journey? What would be your kind of positive takeaways if you can get them?
Well, I've done yoga on and off for a few years, but I didn't really get into it until I got chronic, because yoga helps you to manage your body and connect your mind, spirit, and sort of get to know yourself better and understand your body and the things it's doing. So although yoga on its own won't actually heal you, but it will help you to control your breathing, become calmer so you can sleep better, which is essential to healing. And yeah, breathing techniques which can help with a lot of the breathing issues you can sometimes get with Lyme and stuff like that. So I've just found it helps alongside other treatments. And I know not everyone can have access to treatment, but I also know people who have set up GoFundMes, so that's always an option. And what else did I want to say? I know a lot of people don't get the bullseye rash. I didn't get it. I think there's this misconception that you have to have the bullseye rash. I don't have any recollection of it. If your GP says you don't have Lyme, doesn't mean you don't have Lyme. So yeah, I don't know, but I'm just, along the way, I've gotten better slowly, and I guess there is hope for you as well.
Yeah, absolutely, Steph. No, that's perfect. And how about you, Matt? What would you want to share from that side of things? Because you know you've gone up through all this, but also launched a really successful business, so you've kind of proven it is possible.
So I think on the Lyme side of things, I think the diagnosis and testing is key. And if anyone wants to invest money, then definitely invest in that doctor there. And then after that, really, I think the big thing for me is accepting it. Not as something that's happening to me, but and not as something that's becoming to me, but something you just got to work on yourself. Because as I've learned, I've seen about 8 different doctors, and none of them have, made me completely better. Some have helped more than others, but ultimately the person that can help you the most is yourself. Stella's good recommendation for yoga. We've had different recommendations tonight for saunas and different types of therapy, but getting moving and staying on top of your mental well-being, I think, is super important. And yes, I've been kind of gone into the business world as an entrepreneur the last 2 years, and it's been tough sometimes when you just tired or you've got a brain fog and you're trying to run a business, but you've just got to push through and take time to look after yourself. And own that responsibility and keep pushing, because a lot of people do get cured and they do get better, and I think there's hope for all of us.
Thanks, Matt. Great message, Jen. And Emma, what would you like to share?
Oh, I really needed that, Matt. I've had time and I'm like, there's hope. No, like, I know there's hope. It's just when you're having a really rough time, it's hard. But yeah, I don't have like any advice like in particular, but like before I found out I had Lyme, like I was given 3 to 6 months to live on the NHS, and like that was kind of where we were at. And now I'm here talking, can walk a bit, go out a bit, look after myself a bit. Like I'm not well yet, but from going from that to finding out I had Lyme, treating it and surviving, like my life has obviously completely changed. So I think no matter how bad it is, how long you've been ill, how complex it is, it might take time and it might take a lot of different treatments to try what works for you. But I think, like everyone has said, just to reiterate, like you can definitely get better. So yeah, I just wanted to share that. And I think the silver lining, like for me, has been like now I work with people like one-to-one, helping them guide their like path, whether that's treatments, practitioners, clinics, what's right for them. And it just gives me a lot of fulfillment to now help people with their recovery as well. So yeah, it's just, I think a lot of good can come through the bad, even though it's hard to see it whilst you're in the really bad.
Yeah, absolutely. I think it can really find a sense of purpose and direction. And I think each of you have mention that in some way or another. And I think it's also important to remember whenever you're healing from anything that healing isn't linear, and sometimes you will have good days and you will have bad days, but so it might go like that even if you are moving up. But thank you so much, everyone. I know, Emma, you're having a bit of a rough time, so I really appreciate you coming on. But thank you so much, everyone, for sharing, just being so generous in sharing your experiences and and everything, and your story. You know, I know people really benefit on it. We've already had a couple of messages you might see from the chat, just thanking everyone for, you know, being helpful. If you've enjoyed tonight's event, if you found it useful and you'd like to make a small donation to our charity, we're funding research to find better testing and treatment on the NHS. I've put a link to the donation button in the chat. So if you feel you're able, and if you can, what better time than Lyme Awareness Month? And on that note, it's Wear Lyme for Lyme Day tomorrow, everyone. So make sure I've got my t-shirt ready. Designed by one of the people in the Lyme community, so I'll be wearing that tomorrow. So do take part on social media. There's instructions on our page and on Wear Lyme for Lyme Day's page. But yeah, just say thank you so much to our panel. Thank you for everyone for coming and asking such great questions. You know, be careful with all of the stuff you look into, but I hope you found it informative. And yeah, just take care and be well. Take care, everyone.
Thank you, Rosie. Well done.
Thanks, Rosie.
Thank you. Take care, everyone. A lot of message coming through saying thank you. So well done to you guys. Have a good evening, everyone.
Bye.
Bye.